Good morning. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Yesterday, CADM Provincial Lab performed 734 tests for COVID-19. Today, we're reporting one new case. This individual is a man in his 20s who lives in Winnipeg. Public health investigation is continuing to confirm the details. It does appear that there is a link to a previously announced case. As of yesterday, over 5,600 tests have been performed for COVID-19 at CADM Provincial Lab. We are expanding our testing criteria to include the groups of people at risk of contracting or spreading COVID-19 and are showing respiratory symptoms. So these would include all symptomatic healthcare providers, individuals who live or work in a remote or isolated community, including a First Nations community, people who live or work in a group setting, such as a correctional facility, shelter, long-term care, or residential facility, or remote work camp. Again, this will continue to include our current testing strategy of contacts of cases or those returning from international travel who are showing symptoms of respiratory illness. We've discussed the importance of testing in the past, and certainly testing is an important component of our overall strategy, but it is just one component of that strategy. We test largely to know who to isolate and to perform contact investigations on. We also test to rule out potentially other diagnoses which might be important in the treatment of individuals, and that's why we're testing those who are showing severe symptoms so we can have an accurate diagnosis. We will be moving to testing healthcare workers as well as testing in facilities where spread might be more likely to occur. It is just one aspect of our overall approach to this. Equally as important as our social distancing strategies. Again, when we ask people to stay home when they're ill, regardless of a test result, they are not going to be spreading whatever virus they have to anyone else, including COVID-19. So we know that testing is important, but only one aspect. We need to consider the entire program at once if we want to adequately affect the impact of this virus on Manitobans. In addition to the social distancing strategies or the physical distancing strategies, we are having all returning travelers self-isolate for 14 days. So this includes interprovincial travel, this includes international travel, and as of yesterday, the federal government is placing orders under the Quarantine Act on those returning from international travel to self-isolate for 14 days. As we've been saying to now, we're not really asking. We have the ability to use measures to limit the risk to Manitobans for those who might be taking actions that put the health of Manitobans at risk. But now this order is in effect for all returning travelers from international places. You must quarantine for 14 days. There could be penalties for not complying. Certainly our testing strategy has a balance with our current capacity. The lab has been able to put measures in place to work around some of the worldwide shortages of reagent, and that's why we see the increase in the amount of tests that they've been able to perform as of yesterday, and they'll continue to work on those efforts to increase our lab capacity, and as that increases, we're going to further amend our testing protocols. The most important way of reducing the spread of this virus is to stay home as much as you can. We know that this virus is spread almost exclusively by symptomatic people and through close, prolonged contact with those individuals. Staying home is the best way to protect yourself, the people around you, and our community, including our healthcare workers who are at the front lines dealing with these issues. Other social distancing strategies include frequent hand washing, wiping down surfaces as frequently as possible, coughing, sneezing into your sleeve. Certainly staying home when you're ill is vitally important. Do not enter large groups. ensure that we're having this 2-meter space between everyone in public. These are all measures that can reduce the transmission of this virus. We can limit the people at risk of this virus by staying home if we can, utilizing these social distancing strategies at all times. We're going to really impact the transmission of this virus, flatten that curve, as they say. We continue to strongly advise all Manitobans to cancel or postpone any non-essential travel. This includes travel within Canada, right? Now is the time for social distancing, for physical distancing. This is not the time for business as usual, not the time for travel. Stay home when you can. Practice physical distancing at all times. We've talked about the 3 Ps, protecting yourself, protecting the people around you, protecting our community. These messages are vitally important and will remain important for the foreseeable future. We are in this together. All Manitobans have a role. If you haven't been able to implement these things, it's not too late. Starting today, you can protect yourself and others from the transmission of this virus. You want to protect yourself, wash your hands frequently, don't touch your face, cancel or postpone your travel. Now is the time to stay home. Protect your loved ones by covering your cough and sneezes, avoiding large crowds, disinfecting surfaces regularly. Protect your community, protect our province. Practice good social distancing. Stay home, certainly if you're sick. Stay home when you can. Cancel events. Use reliable sources of information. Manitoba.ca/COVID-19 is our website. Up-to-date information. I strongly suggest people keep up to date with this information. And by protecting our community, we're also protecting our healthcare workers. They are on the front line dealing with this. By interrupting the transmission of the virus, we're protecting ourselves, the people around us, our communities, our healthcare workers. Now is not the time for business as usual. Now is the time for social distancing. We have public health orders in effect right now. I remind all Manitobans of those. We're continuing to review our efforts in that regard, but now is a time for everyone to do their part. We're in this together, and we can all really reduce the impact of this virus if we work together. So thank you very much, and I'll pass it to Lanette.
Thank you. So I would like to start today by acknowledging the lab teams. As Dr. Roussin said, starting today, we have been able to increase capacity at CADM, and there's been a lot of work going on from a lot of teams. So I just want to acknowledge from CADM Dr. Van Cassile and Jared Bullard, who are leading the charge there, but also Dr. Cabani, Peter Cresta, and Abdi Sakora, who are leading teams with the shared health labs and trying to offload as much as possible and coordinate the service. And also a very special thank you to Dynacare, Janessa Naidu, whose team has agreed starting tomorrow, they will take over calling the patients with negative results. So work processes have been sorted out, and we've been working on that for a few days now. They will get the list from CADM as to who has negative results, and they will start calling tomorrow. So that includes the tests that were done today, as well as any backlog that exists. So those of you who've been patiently waiting, thank you, and we will serve you better starting now going forward. Those teams have really had to shift a lot of processes and to meet the demand and prioritize the work related to COVID-19. So thank you to all for that. I just also wanted to give you an update on HealthLinks. So yesterday they received 2,400 calls. Their wait time now is down again to 22 minutes. The online self-assessment tool, since we posted it last week, has seen almost 300,000 views. So we're very excited to see people are making use of that tool. And The other thing I wanted to update you was the community sites. So we have new drive-through sites opening this Friday in Portage La Prairie and Ericsdale, which will bring the number of community testing locations to 14. Portage La Prairie site will be at the Stride Center, which is located at 245 Royal Road, and the hours of operation will be from 9 till 3 daily. The Ericsdale site will be at the Community's Wellness Center, which is located at 35 Railway Avenue, and the hours there are 10 till 3, Monday to Friday. Additional locations throughout the province will be opening in the next few days, including drive-through sites in Pine Falls and potentially at the MPI Service Center in Dauphin. As a reminder, Manitobans need to call HealthLinks to receive instruction as to where they need to be tested. We are testing Manitobans with respiratory symptoms who have traveled out of province within the past 14 days, as well as expanding the screening criteria, which Dr. Roussin mentioned. So all our documents, our guiding documents, will be updated online for healthcare providers who are looking for that. Also, we encourage people to practice social distancing, stay away from large crowds, and stay home if they are ill. And I just wanted to take a moment to thank all the people who are working on our front lines in hospitals and in personal care homes, our ambulance team, our emergency response teams, and our testing sites. We know the sacrifices you make each and every day to help others in time of need, and we recognize that every family and every individual has had to make enormous changes in their daily lives in a very short period of time. Our healthcare workers have children and partners and parents, and they worry about their kids and their families and their communities. And still, they show up to work every day, and they go home and they see a lot of media, what's happening in Europe and south of the border. So that's a lot to take in for all of us. And we just want to say that we are with you. We continue to prepare alongside of you, and every possible step is being taken to make sure that we are ready and that you are protected. So we've got each other's backs, and we're not going to stop until we get through this together. So with that, I will open the floor to questions.
Thank you. A reminder to our reporters, each of you is allowed a question and a follow-up, and then we'll move on to the next reporter, and likely we'll have a second round today. And reporters, please introduce yourself before you ask your question. Today, we start with Carol from the Free Press.
Good morning. It's Carol at the Free Press. I have a question about masks and medical supplies. Are any being rationed here yet? And can you please comment on the supply of masks?
Yeah, that's a good question. So we meet with our logistics team every day and get an update on what the situation is. We've been informed that we do have an adequate supply for the next several months, but we are managing that inventory. So it may feel to people who are working in their usual settings that there's not a plethora of stock everywhere, and that's on purpose, so that early on in this we did see some theft and some hoarding. So we want to make sure that we have supplies that are necessary and needed in the appropriate situations. So we feel right now we have adequate supply of masks, gowns, gloves, and more is coming. Every day there's orders being made and being shipped in.
And my follow-up is for Dr. Roussin. I'm just wondering, when is the government going to reduce the allowable size of public gatherings, and why not get ahead of the curve on this while we can?
Yeah, well, we have been ahead of things. We've suspended classes, we've reduced those crowd sizes, we've implemented a number of social distancing strategies, so we're going to remain ahead of it. And we're constantly looking at amending our approaches, strengthening our messaging, and so it will be in the near future that we're likely continue to escalate our social distancing messaging.
Has there been any pushback from the provincial government on reducing crowd sizes?
There's not been pushback. The decision is largely that of public health to message that. So certainly there's a lot of things to consider when you make changes like this. So we're looking at all of the unintended consequences, all of the implementation issues, all of the issues regarding enforcement, and so we'll be moving forward with that in the near future.
Next will be Bart from CBC Manitoba.
Dr. Roussin, CBC Manitoba. Can you please clarify specifically how many tests you had? More than 5,600? How many tests total done so far now?
It was 5,606 as of yesterday.
5,606. How many people have been swabbed or otherwise tested total? I mean, 5,606 is the process number, but how many people total have been swabbed? Ask that question to determine what proportion of the sample.
Yeah, I don't have that number in front of me. It's a hard number to keep track of because it's on the requisition. There's people swabbed for many different reasons that will be tested at CADM Lab. And so I don't have a number on how many people have been swabbed, and the requisition specifically mentions COVID-19.
But the only reason I ask that is I'm trying to just determine what the processing backlog is. Or have we done 10% of the people we're looking at, 80%? Like, what's the backlog, I guess?
Well, it's quite a large proportion of those tests, and because of CADM's great work to be able to work around some of the shortages, the reports are that there will not really be a backlog by the end of this week, and we'll be back to that sort of 48-hour max turnaround time.
Next will be Patrick from CBC French.
Hi, yes, Patrick Foucault from Radio Canada. Just wanted to have an update on the condition of that woman, that patient yesterday that was in intensive care. How's she doing?
There hasn't been a change in condition at this point. Remains in the ICU, and we'll be following closely.
Okay, thanks. And also, when will we be considering really? I know you answered to that yesterday, and I wanted to see if you had an update on that. When are we going to close the Manitoban borders to, force everybody to not do interprovincial traveling?
Well, closing the borders is one thing. Having this strong messaging, and like I say, it's not really just asking people to self-isolate without some of the exceptions that we have in place. People returning interprovincially are required to self-isolate for 14 days. We're going to have measures in place to ensure that message is out there, that it's getting delivered to the vast majority of people re-entering the province. And so, to actually close the border, I don't think that's on the agenda right at this point, although nothing is off the table going forward. But right now, it's the importance is that people returning interprovincially, with few exceptions, we need them to self-isolate for 14 days, and that we're not really just asking.
Thanks.
Brittany from Global TV.
Good morning, Brittany with Global News. Dr. Roussin, we're having a lot of people confused with the self-isolation rules about when that time begins, and then if they do end up having to get tested, if that time restarts. Could you give us a bit of a breakdown for people to understand, along with if they get a negative result, if they can then come out of self-isolation?
Right, so this is a very common question. So the 14-day period we discuss is what's called an incubation period, the period in which you're first exposed to the virus to the day where you could become sick. And so for that, for this virus, with some safety factored in, we say 14 days. So if you were last exposed to the virus, whether it's international travel or to a case, and you got sick at day 5 and tested negative, or that it was another virus causing your symptoms, that does not get you out of the 14-day period. You could still be incubating COVID-19 for that 14 days. So that's why that negative sample, if you've been exposed, does not get you out of the need to self-isolate.
Up here, a lot of parents still, I guess, kind of confused, some upset about the fact that they're getting mixed messages here with school. We are only on week 2 here. We've said that school will go back kind of mid-April. Is that still the plan? What do parents need to know now, and why not just cancel the year like we've seen in Alberta and other jurisdictions?
Yeah, we're looking at that. Other jurisdictions have different dynamics right now, so we are constantly looking at how we're going to approach this. This is something that we need to expect to be in the long run. This is not going to be a sprint. So in a couple of weeks, this is not going to be over. So we're looking at how we're going to message that, what steps we're going to take forward, especially with the school suspensions, and we'll have more to follow on that.
Would you suspect that parents will not be sending kids back on that original date that we had set?
Right. So the way that things are moving here, that we really haven't even seen the sustained community transmission at this point, it's difficult to comprehend a scenario where we would be returning people, we're lifting our social distancing strategies anytime in the next few weeks.
Diana from CJOB.
Yes, good morning, Diana from CJOB. Question for Lanette. You mentioned the theft of supplies kind of early on. Can you kind of expand on where, when, and how this happened, and was this a significant impact on Manitoba's supply?
It happened very early on where we had, there can be hoarding at any time, so that's not unusual, but there was some theft early on, and probably even before our first case was confirmed. It was more just the anticipation. So when we first heard that happen, it wasn't a Winnipeg site. That's where we decided, for the safety of all, we needed to get better control of our inventory.
And was anyone punished for taking those supplies?
We were not able to identify who that was.
And for Dr. Roussin, quickly, the increase in capacity at CADM Lab, can you kind of go into a bit more detail about how this workaround works? And is this sort of where our capacity taps out, or is it possible we might see some more increases in capacity?
Right, so the interworkings of the lab is very technical, and we rely on their expertise, the number of individuals and working collectively there. So it's difficult to comment on the multiple steps they've been taken to increase the capacity at this point, and they are looking to continue to expand. And we're looking at many avenues to expand our testing. So this is not what I would describe as a cap out for sure. We're going to continue to try to increase this.
From the Winnipeg Sun, Scott.
Hello, Scott Bill from Winnipeg Sun here. Just a question on testing. The WHO continues to say it's the most important thing, but is there a certain percentage that would be ideal, of like a certain percentage of the population that would be ideal for testing? Like, not obviously 100% would be best case scenario, but is there an ideal percentage that experts would like to see?
It's hard to comment on an ideal percentage because that's going to depend largely on where you are in your local outbreak. And so testing is important, but what's most important is the overall strategy. And so testing those that are sick is important. Isolating them, doing contact investigations, these are all very important things. But the social distancing, the physical distancing strategies that we have in place complement the testing and all of the approaches that we have, right? So people who are ill stay home. Almost 80% of individuals who are infected with COVID-19 have mild symptoms and recover at home. And so if you're ill and you stay home, then we're dramatically reducing the transmission of this virus. If the people are socially distancing out in public, we don't advise that people keep their distance from only sick people. We are advising you keep your distance from all people. Stay home when you can. Keep that social separation when you're out in public. Limit groups in crowds. So these are all together the approach that we're taking. So testing is just one component of that. There's a lot of focus on it, but it's only one component. Without the other strategies, testing won't get us out of this.
And then my follow-up is, for people that are returning from, let's say, hotspots of outbreak, I talked to one woman who returned from northern Italy, as an example, and hasn't been tested. Why wouldn't testing be done for somebody who comes from a hotspot, regardless of whether they have symptoms or not, just given that they've been in the proximity of a substantial outbreak in another country?
Right, so if they were tested and tested positive, they would be required to self-isolate for 14 days. If they test negative, they're required to self-isolate for 14 days. So it doesn't change our management. So we have things in place to deal with that. So asymptomatic testing is not a terrific strategy. Tests that are negative, that are very early on, could give us false sense of security. But somebody returning from any international travel, any interprovincial travel, needs to self-isolate for 14 days. So that's the important aspect right there. They're not going to be transmitting that virus to other people. They're self-isolating. And so testing doesn't really change our approach there.
Thank you.
From Canadian Press, Steve.
Oh, hi, Steve Lambert from the Canadian Press. Doctor, I wonder if you can tell me what First Nations might qualify under this expanded scope for testing. It talks about remote and isolated communities. Some are fly-in only, some are connected by road, but it's a very long drive to the next community. Can you give us some detail as to how many or what the line is between remote and isolated communities that might qualify for expanded testing?
Yeah, we wouldn't really distinguish between the First Nations. So certainly the remote isolated communities would be at a different risk level because of the remoteness. But if we receive samples from a First Nation, and we would run those.
Okay, so my follow-up would be, what qualifies as a remote or isolated community? Does it have to be fly-in only? Does it have to be more than 2 hours from a major center?
Not making a distinction. So right. So if there was testing performed on a First Nation, we would accept that sample. So it doesn't have to. We don't need to define what is a remote or isolated community for these purposes.
Sorry, but the testing is being expanded to people with respiratory symptoms in remote and isolated communities. So what are remote and isolated communities?
Yep. So, I mean, if we're talking about remote and isolated communities, then those are typically fly-in communities.
Thank you.
Bud from the Brandon Sun.
Hello, it's Bud from the Brandon Sun. I've got a question for each of you so you don't feel left out. To Dr. Roussin, can you tell me if the province has been requesting reagents from other outside laboratories or doctors outside of Manitoba?
The lab has been doing what it can to work around here, so I don't know all of the details of every aspect of its interworkings. So they deal with these capacity issues for multiple tests, I'm sure, all the time. So they've managed to increase their capacity. They've worked around. They've changed some of the processes, and they're advising me that they can continue to increase capacity, but I can't report on the exact details of all their interworkings.
Okay. And for you, Lanette, you had mentioned potentially Dauphin, but MPI put out a news release today saying it is closing as of today and will be opened. Is there any doubt as to that?
No, I don't. I think what the regional health authority was looking at was the demand to open it. So we are leaving it to them to operationalize it. But if and when one opens in Dauphin, then I think they'll that will probably be the site.
So then the office will be closed and not being used from today on?
I'm not sure about those details, Bud. I think there's been some good partnerships in Winnipeg with MPI, so that might be an example to follow. But I don't know the details of how they're operationalizing it at this point. So they're looking at the volumes and the demand and how they can partner as well. So it doesn't. I'm not sure. I don't think MPI has to leave, but I think it's just a matter of how do you organize the space.
You can't see any way that they are going to remain or come back on with the COVID-19 still going on. Why are you not then saying today or tomorrow, yes, we're expanding, schools are not open, April 6th, wherever it is, so that parents can at least try to make other arrangements for them?
Yeah, I mean, we've been ahead of things. Compared to many jurisdictions, and we're looking. There's a lot of aspects to this that we're working on, and so that's one of them. And so we are looking at trying to get a better picture on when we can make announcements. You know what we're going to decide. So these are all evolving scenarios, and so we're the vast efforts here from a lot of departments in the government. Really, all government departments are working together on this, so we'll make some announcements.
Okay, thanks, guys. That's for me.
Thank you.
From CTV Winnipeg, Michelle.
We're wondering, what are the biggest questions that you're being asked through HealthLink COVID-19 related, other than, do I need a test?
What are the questions? So usually if people would go through the online screening tool, there is direction to go to HealthLinks to talk through more details if that's one of the flags that comes up. So the questions, are you asking the questions from HealthLinks to the patients, or the question from the patients to HealthLinks?
From the patients to HealthLinks. Like what other questions are people asking other than, do I need a test? Do they have other concerns? Like, are the main ones that kind of get asked over and over?
I can confirm that with you. I have my suspicions of what they're asking, but let me find out. I do believe that they track those types of qualitative indicators. So let me get back to you on that, Michelle.
Okay, thanks. And then the other question is, today is 2 weeks since our first reported case, and Dr. Roussin, you did allude before that you could potentially start reporting recovery. So do you have any reported COVID-19 recoveries to report from the past?
Right, so I don't have any that I can report now. You know, typically this isn't something that is monitored through our surveillance unit. We don't usually report on recoveries from any conditions. We usually just report on the total number of conditions. But for this, we are going to be accumulating that data and trying to report it. So I don't have any right now, but it is something we're working on a process to be able to do that.
From City TV, Stephanie.
Good morning, Stephanie from City News. Just wondering if there's an update on the investigations of any of the 14 cases from yesterday, if there's any evidence of community transmission in any of those cases.
I don't have any updates that would lead us in that direction. All of the cases to date are being linked to either travel or to a known transmission chain, and that's where the investigation remains at this point. We're going to now really expand our testing, and we'll continue to search for evidence of community transmission. We also have those syndromic surveillance that we have in place, where we look at hospital utilization, ER visits, looking for community-based transmission. We haven't got any signals as of yet.
And then just regarding the number of tests completed at Chatham yesterday, is this the largest capacity that the lab has done to date since the pandemic started?
I believe that's been the greatest number of tests given in one day since this started. I don't know that for sure, but it looks like probably the largest number in a single day.
Thank you.
Cassidy from the Flin Flon Reminder.
Hello, good morning. This is Cassidy from the Reminder. I'm wondering, there's been a ban on, or not a ban, the mandatory self-isolation and on travel outside of the province. What about traveling inside the province if you're traveling long distance, like, say, from Flin Flon to go visit family in Winnipeg?
Right, so travel within the province is not specifically dealt with by any order or recommendation right now, with the exception of many First Nations have limited the non-essential travel to and from those communities. And so within the province right now, there's no reason for us to limit interprovincial travel, intra-provincial travel, with the exception of remote isolated communities such as what many of the First Nations are recommending.
Okay, thank you. And I guess a quick follow-up here. Is the testing technique something that is being shared with other jurisdictions, or you learn from other jurisdictions?
The testing within the lab?
Yeah, the new technique that's being used.
Well, they are part of a national working group that shares different recommendations, various recipes for their viral transport media, for instance. So they're well connected across the nation at the lab level.
Okay, thank you.
All right, we'll go to second round. Top of the muster, Carol from the Free Press.
I have this question for Lanette. And you said that there's a supply of masks for the next several months. And I'm just wondering, is that something you would normally have, like several months supply on hand at hospitals for masks? And
well, yeah, we do keep a supply of masks. Obviously, we've stocked up more, knowing that COVID-19 was on the rise. And so I would just remind everyone that we've been planning for this since end of January, maybe even a bit before. So yeah, the stocks are more than what we would normally have for sure. And also just doing the work of making sure that staff who require those N95 masks for aerosol generating medical procedures have to be fit tested. So that actually takes a little bit of, uses the masks to do the fit testing. So we have added more supply than what is normal.
Okay. And my follow-up question is about the positive cases so far. Have any of those positive cases been connected to a care home or a long-term care or personal care home?
That I have not been made aware of any connection of the such. So I haven't been aware of any contacts that have been identified in those locations.
All right, Bart from CBC Manitoba.
Yes, sir. We're hearing there's still a backlog in getting child care for frontline hospital workers. We're also hearing from daycares who say they're ready to take on these children, and despite reaching out to the province, aren't getting a response. Why are these delays and this confusion still occurring?
I will follow up on that. When it first started, I think it was on Friday, we understood that 85% of healthcare employees had daycare secured for their children, and then the process is that if they're having trouble with that or if they need it, they should be going through identifying that with their employer, and we will make sure they are connected with the Department of Families. So I would encourage, if anyone is struggling with daycare, healthcare providers, that they let their employer know, and we make sure that we clear the way and make a path for that to happen.
And final question, Dr. Roussin, we know we have 266 ventilators and more on the way. What would the ideal number of ventilators for a province of 1.4 million people be?
That's a tough question to answer. It depends on the changing dynamics that we have. So we have modeling continually going on in place. And so it's hard to say a ideal number. There's a large variability in the modeling numbers that we have, and so we're looking to prepare not only for the expected case, but we're looking to prepare for the worst case. So I don't have a specific number that I could tell you, but we are putting things in place to prepare for worst case scenarios. And ventilators, critical care beds, those type of things are what we are part of that plan.
Thank you.
From CC Radio Canada, Patrick.
Yes, hi, Patrick Foucault from Radio Canada. I guess just one question. Would you be able to say how many confirmed cases do we have and how many presumptive or, I guess, probable cases do we have?
Right. So we will be changing our process that going forward, the CADM provincial lab will be able to confirm these cases in-house. And so during that transition over the next couple of days, I don't have the updated numbers on which ones are confirmed or probable right now. We'll have those specifics by tomorrow.
All right, that's it. Thank you.
From Global TV, Brittany.
Good morning, Brittany with Global News. Just a quick question. Do we know how many healthcare workers might be in isolation right now and what effect that has on our system?
I don't know. I don't know the answer to that, Brittany.
How are dealing with everything in the hospitals right now, given the fact that we were seeing such high flu numbers? Are we still seeing those effects on our healthcare system?
Sorry, can you repeat the question, Brittany?
Given the flu season that we had and the number of cases that were in hospital and the backlog we were seeing there, are we still seeing such an effect on our healthcare system right now because of the flu?
Okay, sorry. So we are seeing in the lab results that there is influenza in the community. We're not so much seeing it in the hospital, and we certainly did see quite a surge in December and January, and the system was really at maximum capacity. We're not seeing that right now. The critical care beds are, I think, under 70%, and the internal medicine beds, family medicine beds, are just below 80%. Which is not our norm, but we're very grateful.
From CJOB, Diana.
Yes, Diana from 680 CJOB. Just a quick question of clarification for Lanette. The next two community testing sites opening up tomorrow, that was Ericsdale and Portage la Prairie. I'm just seeing in the release it says Pine Falls. Can you confirm which ones are opening up tomorrow, and if Pine Falls is not one of those, when that one's coming?
It is Pine Falls. Hold on, we're checking. Pine Falls what? Will be weekend. Oh, Pine Falls will be on the weekend.
Okay, perfect. So Ericsdale and Portage tomorrow, and then Pine Falls on the weekend. So are these 15 at the end of the weekend?
Correct.
Okay, thank you.
From the Winnipeg Sun, Scott.
I was just wondering, given that the CADM lab has been able to find a workaround for this, has there been an expression of interest from other countries about that and I guess a sharing of information on that?
I'm not sure what, I know CADM Lab and professionals there are connected nationally. They're probably well connected internationally. So I think that this type of information's been disseminated. They've probably learned from other jurisdictions as well. So I don't know all of the details of who they're talking to or what information's been shared.
Okay, thank you.
From Canadian Press, Steve. EP Steve, are you there? Bud at the Brandon Sun.
Yes, I just have a quick question regarding public transit. Brandon Transit has waived its fares for now. And I'm just wondering if you don't think this is perhaps counterintuitive, if it's going to attract more people to ride public transit, especially when you say that people should maybe not be riding public transit as much. Could someone comment on that?
Well, certainly the social distancing messages are getting out there. We're seeing that we're not seeing crowding on public transport. And so tough for me to comment on what the actual effects will be on that or what the intent of waiving the fare for. There's lots of other reasons. People are finding it difficult in these times, changing a lot of what they're doing, so that may be the reason for it. So social distancing, important, including on transit, but we've seen with much of the social distancing message, we're not seeing a lot of crowding on public transport.
All right. Thank you very much. That's it from me.
Over to Michelle at CTV.
I'm just seeing a lot of places are switching to the word physical distancing rather than social distancing. Would you guys consider changing that, and why?
Yeah, I think we're moving towards that because we really want to make sure that so this is a time for Manitobans to be working together. Right, so we talk about social distancing. It's really the physical distancing that we're talking about because, as we mentioned, social distancing is not social isolation. Right, we need to ensure we're staying connected with the people around us, those that are most vulnerable, making sure we can stay connected. We've seen declines in the ability to get to faith-based organizations, so we need to make sure that we still have that connection. And so social distancing might be perceived as that social isolation. What's really important is the physical distancing, and I think we'll start changing some of our messaging to ensure people are well aware that we got to stay connected with people, stay connected with those vulnerable, reaching out to our neighbors, lending that helping hand, going to places like helpnextdoormb.ca for volunteer services that are available. So it's really the physical distancing that's important, and I think we'll try to change some of our messaging that way.
Okay. Also, I'm wondering if there will be any other investigations into people who die of respiratory symptoms in the community, if they got a test or not. Would those cases be tested, or are we looking into that at all?
We are looking towards that. So from the literature, there are pathological findings that can be consistent with certain the COVID-19, say pneumonia and issues like this. So certainly people presenting with severe respiratory symptoms have been tested, going back now a number of weeks. And so we will be in touch with the chief medical examiner to ensure that unexpected, say, community deaths from respiratory illness would be investigated with COVID-19 in mind.
Stephanie from City News.
I'm just wondering if there have been any fines or penalties handed out since the state of emergency went into effect.
There have not been any fines or penalties issued from public health, and not any fines or penalties issued from in this regard that I'm aware of.
And then just quickly, since we're changing our method of how we deliver negative results to people, just wondering how long people can expect to hear the negative results with the new system being put into place tomorrow.
So it's my understanding that most of the regional health authorities are calling their patients with negative results. Starting tomorrow, we'll have the added support of Dynacare calling. So I would have to see what the list is. Obviously, there were 700 tests done yesterday. So as fast as they could do it, I think I'm going to reserve the answer to that until I maybe see what happens in the first day. But it certainly will be faster than what it has been in the past. And we'll monitor those results and just let you know as well. It's a really good question.
From frontline, Cassidy. All right, so we have time for a few more questions. If anyone has one or two more, we have a couple of minutes here.
Hi, Dr. Roussin. It's Carol at the Free Press. I just wanted to ask, you said that CADM's going to be able to do test confirmations as well. Is that because the National Microbiology Lab is at capacity or too busy? Or could you just explain to me why that's happening now with confirmations happening at the provincial lab?
That's right. So it's what's happened in many other provincial labs. So once the provincial lab has done a certain amount of tests, then they can put in a process to be able to confirm their own results. There would only be perhaps certain ones that might go out to the national lab, but this is very consistent with other provincial labs throughout the nation. Many of them are right now able to just confirm it in-house.
Is there a plan? You're talking about social distancing versus physical distancing and social isolation and reaching out to people who are vulnerable. And I'm wondering about the shelters, emergency shelters and other shelters where there has been, reports of crowding. And I'm wondering, is there any plan to commandeer private businesses or public schools that are empty to shelter people who need a place to stay?
Yeah, that's a great question. We are reaching out to look at what the options are for different populations, and the homeless and the vulnerable for sure would be one of them. So those conversations are just happening now, and we will be giving you an update in the near future. But we are looking at hotels. There is the possibility of potentially gyms and schools as well, but more to come.
Lanette, you're saying that yesterday the wait time for health links was an average of 22 minutes, but we're still getting people saying that it took them 2.5 hours to get through yesterday. Is there better times or peak times that we're seeing that maybe people should try to avoid if possible?
I think probably yesterday would have seen a significant improvement because we added a line to it where it should have even sped up the process more. So I'll look into that, Brittany. I know they're doing everything they can, and I'll see if there's a peak time and low time and get back to you.
Was that a specific line, Lanette? Sorry. Is there something special about the line that was set up yesterday?
Yeah, so they've used a few different strategies to help take some of the pressure off of HealthLinks. One is adding more staff. One is putting the online screening tool. One is adding more lines. So originally when we went down this road, there was about 28 or 30 lines. Now there's well over 100. And then we also have a phone line, so you can, if you don't have internet access or you're not IT savvy, you can call in and do screening by pushing the by going on the phone. And then there was also some work done by our telecom company to streamline the process as well. Yesterday that went into effect.
Awesome. Thank you.
All right, everyone. Thank you. That concludes today's media briefing.